Hello, and welcome to Dr. Williams Clinic, where health meets knowledge. I'm Dr. Ola. Hi there. In this video, we will explore the essentials of diabetes, a chronic condition that affects how your body regulates blood sugar. We will break down the different types of diabetes, symptoms to watch for, and tips on managing it for a healthy lifestyle. So, what is diabetes? Diabetes is a chronic medical condition that occurs when the body is unable to properly regulate blood sugar. Glucose is the main source of energy for our cells, and its regulation depends on a hormone called insulin, which is produced by the pancreas. There are three main types of diabetes. There is type 1, which is an autoimmune condition where the body attacks insulin-producing cells. The second type of diabetes is type 2 diabetes, which results from insulin resistance or deficiency, often linked to lifestyle factors. And the third type of diabetes is gestational diabetes, which occurs during pregnancy and can increase the risk of developing type 2 later on. Let's talk about the statistics and how diabetes has actually affected human race. Globally, diabetes is a major health concern. According to the International Diabetes Federation, as of 2021, over 537 million adults are living with diabetes, with numbers expected to rise to 783 million by 2045. In the United States alone, the CDC reports that about 37 million people, or 1 in every 10 adults, have diabetes, with 90 to 95% of cases being type 2 diabetes. Diabetes is the leading cause of complications like heart disease, kidney failure, and blindness, making early diagnosis and management crucial for preventing severe health issues. Let's talk about the signs and symptoms of diabetes. Recognizing the signs and symptoms of diabetes early is important for effective management and prevention of complications. The symptoms can vary depending on the type of diabetes, but some common signs include increased thirst and frequent urination. When blood sugar levels are high, the body pulls water from tissues, causing dehydration and making you thirsty, leading to more frequent trips to the bathroom. Another key symptom is unexpected weight loss, particularly in type 1 diabetes, where the body is unable to use glucose for energy, so it starts breaking down muscle and fat. Another signs or symptoms of diabetes is fatigue, which is also common as the body struggles to get energy from food. Blurred vision may occur when high blood sugar pulls fluid from the lenses of your eyes, affecting focus. Other few signs and symptoms are slow healing of cuts and wounds, frequent infection, and numbness or tingling in hands and feet. These can also signal diabetes due to poor blood circulation and nerve damage. Other symptoms specific to type 2 diabetes may develop more gradually and include darkened skin in areas like the neck or armpits, a condition known as acanthosis nigricans, which can indicate insulin resistance. If you experience any of these signs, it is important to seek medical advice for testing and proper diagnosis. Talking about diagnosing diabetes, typically it involves a few simple tests to measure blood sugar levels. The most common test is the fasting blood sugar, which also known as FBX test, where your blood sugar is measured after not eating for at least 8 hours. A fasting blood sugar level of 126 mg per dl or higher indicates diabetes. Another common method is the A1C test. A1C test, which measures your average blood sugar level over the past 2 to 3 months. An A1C level of 6.5% or higher suggests diabetes. For more immediate results, the oral glucose tolerance test, OGTT, checks how your body handles glucose after consuming a sugary drink. and a reading of 200 milligram per DL or higher after 2 hours indicates diabetes. Sometimes random blood sugar tests are used, especially if you are experiencing symptoms, and a level of 200 milligram per DL or higher at any time suggests diabetes. So, early diagnosis through any of these tests is crucial for managing the condition effectively. Let's look into the treatment of diabetes. Treating diabetics focus on managing blood sugar level to prevent complications and maintain a healthy life. The approach varies depending on the type of diabetes. For type 1 diabetes, where the body produces little to no insulin, the treatment involves daily insulin therapy. This may include insulin injections or the use of insulin pump. Monitoring blood glucose level regularly is crucial, and many patients use continuous glucose monitors, also known as CGM, to track levels in real time. Lifestyle changes such as balanced diets and regular exercise play an important role. For treatment of type 2 diabetics, which is often linked to lifestyle factors like obesity, inactivity, treatment usually begins with lifestyle modifications. A healthy diet low in refined sugar and high in fiber, paired with regular physical activity, can significantly improve blood sugar control. Then weight loss is particularly beneficial for those who are overweight, as it can improve insulin sensitivity. In some cases, oral medications like metformin are prescribed to help the body use insulin more effectively or to reduce glucose production by the liver. As the condition progresses, some individuals may require insulin therapy or other injectable medications. How do we treat gestational diabetes, which is the third type of diabetes? This is usually managed through diet, exercise, and sometimes insulin if necessary, to protect both the mother and the baby. With the right combination of treatments, many people with diabetes can lead healthy, active lives. Let's talk about few complications that can arise if diabetes is not properly managed. Diabetes can lead to serious complications that affect various parts of the body. Like cardiovascular disease is one of the most common, as high blood sugar can damage blood vessels, increasing the risk of heart attacks, strokes, and high blood pressure, nerve damage, also known as neuropathy, which is another common complications, often causing pain, tingling, and numbness in the hands and feet, and in severe cases leading to limb amputation. Another complication is kidney damage, which is called nephropathy, as excess sugar can harm the kidney's filtering system, potentially leading to kidney failure. Diabetes can also cause vision problems, including retinopathy, cataracts, and glaucoma. In extreme cases, blindness. Additionally, slow healing of wounds and a weakened immune system increase the risk of infection, including foot ulcers. How do we prevent diabetes and prevent all these serious complications from happening? Preventing diabetes, particularly type 2, involve making healthy lifestyle choices, maintaining a balanced diet rich in whole grains, vegetables, lean proteins, and healthy fats, while reducing the intake of processed food and sugars can help regulate blood sugar level. Regular physical activity, such as 30 minutes of exercise most days of the week, improve insulin sensitivity and help maintain a healthy weight, which is crucial for prevention of diabetes. Avoiding smoking and limiting alcohol intake are also important, as these habits contribute to insulin resistance and other health issues. Regular screenings for blood sugar levels, especially those with family history of diabetes. These lifestyle changes not only lower the risk of diabetes but also improve overall health and well-being. Thank you for watching. We hope this video has given you valuable insights into diabetes and how to manage or prevent it. Remember, staying informed is the first step towards better health. Stay healthy, stay informed, and I will see you in the next video.